Salam, welcome to a little push, 5 minutes medical mnemonics. Let's set the scene today. Picture this. A 20-year-old guy is rushed through the ED doors. Just about 30 minutes ago, he took a bee sting. And now, he's completely crashing. His blood pressure is tanking, he's wheezing heavily, and his skin is just covered in these bright red, intensely itchy hives. We're looking at a high-stakes, incredibly rapidly evolving clinical scenario here.
Okay, let's dive into this. So our patient is showing us the classic triad of systemic anaphylaxis, right? Hypotension, respiratory compromise, and skin manifestations, like urticaria. But what's actually happening down on the cellular level? To effectively save him, we really need to understand the underlying mechanism driving this terrifying emergency. And that brings us right to our first major memory aid: first and fast. Anaphylaxis is a type 1 hypersensitivity reaction. That's your first, and it happens fast, literally within seconds to minutes of exposure. But why? Well, it's because this patient already has preformed IgE antibodies just sitting there on the surface of their mast cells and basophils. When that bee venom enters the body, it cross-links those pre-existing antibodies, triggering an explosive, immediate release of vasoactive mediators like histamine straight into the tissues and circulation. Now, let's zoom out for just a second to look at the broader clinical picture. To remember exactly where anaphylaxis sits among all 4 hypersensitivity reactions, you can use the mnemonic ACID. A is for anaphylactic, our type 1 reaction. C is for complement-mediated cytotoxic, which is type 2. I is immune complex mediated for type 3. And D stands for delayed, the cell-mediated type 4 reaction. So the key takeaway here is that our patient's bee sting triggered that A, the super rapid type 1 anaphylactic response. Understanding this mechanism helps us build our primary treatment protocol to save our patient. We're going to use the high-yield acronym BASE, B-A-S-E. We kick things off with B, which stands for Benadryl, also known as diphenhydramine. This is an H1 antihistamine. It's incredibly effective for managing those cutaneous symptoms, the flushing and the hives covering our patient's skin.
Moving right along in base, we hit the letter A. Historically, A stands for aminophylline, which you'll often see noted as a treatment option, particularly in surgical contexts for severe bronchospasm. But it's super important to note that newer clinical sources often prioritize inhaled beta agonists like albuterol for really targeting those wheezing airways and reversing respiratory distress.
Next up is the S in BASE, which stands for steroids, things like hydrocortisone or methylprednisolone. Now, what's really interesting about this intervention is the timing. Corticosteroids are absolutely crucial to the protocol because they prevent late-phase inflammatory reactions. However, they take 4 to 6 hours to actually start working. So they are a delayed defense, definitely not an immediate fix.
And finally, we arrive at the E in BASE. Listen, make absolutely no mistake. This is the most critical letter on the board. E stands for epinephrine. This is your absolute first-line drug of choice, period. We administer it intramuscularly as a 1 to 1,000 solution. Unlike those steroids, epinephrine goes to work instantly to restore central perfusion pressure and completely reverse airway obstruction. It is literally the immediate lifesaver. So this brings us to a massive, high-yield clinical correlation. When we compare these options, a very critical distinction reveals itself. Epinephrine is your one and only true must-give medication for a life-threatening anaphylactic shock. Every other drug in our base mnemonic, the antihistamines and the steroids, they are strictly second line. They're just adjuncts. They absolutely do not treat the immediate life threat of laryngeal edema or cardiovascular collapse. You've got to give the E to treat that first and fast reaction.
All right, it is time for a rapid review quiz to make sure this vital information really sticks. I want you to shout out the answer if you know it. Ready? Here's the question. What is the first-line medication, route, and dosage for anaphylactic shock? I'll give you a few seconds.
Did you get it? The answer is epinephrine, given intramuscularly as a 1 to 1,000 solution. If you got that right, fantastic job. Remembering BASE and first and fast will absolutely help you provide rapid care on the wards and crush your board exams. Keep pushing yourself to master these high-yield concepts. It really makes all the difference for your future patients. But it does make you wonder, with anaphylaxis incidence rising globally, what environmental factors are triggering these preformed IgE antibodies more frequently today than ever before? Something to think about. Until next time, salam.